Dr. Ferstandig, what do you believe is the biggest problem in today's society with people beating their addictions?
Well, first of all, the biggest problem is that many people have attempted, either on their own, and as we know with opiates, which is one of the huge problems, that's essentially impossible. Almost everybody fails. Some people take longer than others, but almost everyone fails. And most people, sadly, when they've turned to professionals, have not walked away with an experience that they find rewarding, positive. And so they become demoralized, and they're starting to have this terrible thought, this is the way the rest of my life is going to be.
So what is it that's different about your approach, and how does it address that issue?
My approach came exactly out of what I just relayed to you, in that my number one goal on my first meeting is to ensure, to the best of my ability, that the patient walks out of my office after the first meeting with a greater sense of hope than they walked in. And it's got to be real hope. I don't want to just, be a cheerleader. It's got to be based on a real reason. And if I can do that, they are so much more committed to the process, and the more committed they are, the better the outcome.
And it's all about the therapy plus the medication comes together?
In my opinion, and it's just my opinion, but it's a very strong opinion, medication alone just doesn't work. And sadly, due to insurance company influences and trying to keep the costs down, most psychiatrists have been relegated into becoming medication dispensers, and they rarely even use their therapeutic skills. To me, if you really want to get the best outcome, fine, use the medicines to help recenter the person back to where they maybe were before the problems, and then you need to work on how did we get into this mess, and more importantly, how do we get out of this, and then start teaching them the things. And what I love to do, medicines are to me like tools. You can create a very rapid change. Then I like to show the patient, are you surprised about how fast we were able to make this change? And oh, hey, by the way, we're just using the medicine to demonstrate that now and to bring you back. But you'll be able to do this without medicine. And this look of wonder and excitement is just all over their face.
Because they've heard different things and they've not had success.
I think it's really the second thing. Most of them have tried, however structured, however guided or misguided, and they've not had a good outcome. So there is a very negative fear, if you will, of that there is no way out, that this is the way my life is going to be. When I talk to my patients who come in for any of a multitude of addiction problems, be they purely behavioral like gambling, shopping, sex, or something, substance abuse, one of the things I say to them that almost 100% of the time gets the response. I said, so have you had the conversation yet? And they look at me and they go, what conversation? I said, the conversation where you're looking in the mirror and you're talking to your image as if it's another person, and you're saying to that person, I don't like you because you're going to amount to nothing. The room gets very quiet and they go, oh my God, how do you know? Of course I know, because I had that conversation at one point in my life when I was addicted to cocaine. And I think it's funny, I spent a long time hiding from myself about how could I, the doctor, become addicted. And yet the answer is very simple. I'm human. I made a mistake and it bit me. And you, one of the people who helped me realize I need to embrace that, because maybe there's a little role modeling that's going on as well that says, hey, you can get beyond this. And that gets back to the hope again. If you can instill hope and they believe it firmly, boy, you've got somebody who is willing to change, because that's what we're talking about. We've got to make a lifestyle change. We've got to make perceptual changes. And why do we have to do that? Because we then have to be honest with the fact that we've made some decisions historically that really weren't so wonderful.
Now, your patients have just raved about working with you and your success with them. It's a very genuine, heartfelt feeling. They feel a closeness, and they you said the word hope. They seem to be rejuvenated with hope. Tell us about what they're saying about your results.
You've pardon my smiling, but what you've just hit on is, for me, the most rewarding part of my job. It is great to see somebody walk into my office who really feels this may be their last thing, and to then have them saying, I want to get up on a soapbox and share what you've helped me do. What they're really saying is, and I'm flattered by that, but what they're really saying is, I want to share with the world that I dug myself out of a hopeless place, and I'm excited about my life. And every time one of my friends or family says, God, it's great to have you back, or in some cases, never even realized how wonderful you were. That's kind of like the American Express saying, that's priceless. That's better than what they pay me. And I'm really fortunate. I have a lot of patients who are going, how come you're not letting me get on the radio and talk about you? Your time's coming.
Well, in all the headlines and all the terrible news we're hearing about addiction and drugs in our area, it's great to hear some talk of hope and talk of solution. And I want to thank you for sharing with us.
Thank you very much.